If you are that person that gets lost anytime someone uses a simple medical term, either being your doctor or some medical student on the street who wants to brag, here are 25 common medical terms that you are very likely to meet in every medical conversation.
Number 1, we have benign, which means not cancerous. For example, if a tumor is not cancerous, it's known as a benign tumor.
Number 2, malignant, which means cancerous. For example, a tumor can be malignant, which means the tumor is cancerous.
Number 3, we have anti-inflammatory. Anti-inflammatory is any kind of drug that goes against inflammation, which is the swelling, accumulation of fluid, or tenderness of any part of the body.
Number 4, body mass index. This is the measurement of the body fat using height and weight. This is used to determine dieting.
Biopsy. I'm sure you've heard in a lot of movies, especially when doctors are talking about biopsy. Well, let me tell you what it is now. Biopsy is the taking of a tissue for sampling for testing purposes. For instance, it's used to diagnose diseases and have a better understanding of what is occurring in the body.
Hypotension, low blood pressure. The normal blood pressure is about 120/80, that is the systolic and the diastolic.
Hypertension, high blood pressure. When your blood pressure reaches 140, it is termed as hypertension.
Lesions. This is defined as mechanical damage like wounds or cuts. For example, you can have a lesion on your spinal cord.
Outpatient. This is when a patient checks in and checks out the same day.
And of course, inpatient is a patient that stays in for the night for 2 or more days.
Okay, acute and chronic. Acute, it comes suddenly and stays for a short period of time. And chronic, it comes gradually and stays for a long period of time. Example of an acute disease is common cold. An example of a chronic is diabetes.
Angina, pain in the chest that is related to heart diseases.
The epidermis, that's the outermost layer of your skin. Forget the English, this is your epidermis. Neutrophils, these are the first type of white blood cells that are mobilized to the side of inflammation.
Edema, this is the accumulation of fluid on a part of a body. It usually comes with inflammation, which comes with infection or physical trauma. Embolism, blood clot. Sutures, they are stitches. These are materials that are used to stitch up a wound, especially during surgery.
Polyp, it's a mass or growth of thin tissue. Compound fractures are those fractures where broken bones protrude through the skin. And then comminuted fractures are those fractures where the bones are broken, shattered into pieces, but do not protrude through the skin.
So the next time you hear or see these words on television or in conversations or while reading, you are going to understand what you're talking about. If you learned something new in this video, please like the video and subscribe to our channel because that helps us a lot. And if you learned a new word, please comment below. If you have any corrections for the words we put out there, please comment below. And if you have words or medical terminology that you would like us to make videos about, please comment below so that we can discuss. Thanks a lot for watching, and again, see you next week.